Understanding sickle cell disease.
Many people know something about sickle cell disease. Usually what a person has learned has come from hearing the worst possible thing that has happened to somebody who has the disease. And oftentimes what they have learned may not be absolutely true. In fact, most children don't have all that many problems, and the problems that they have are usually either not that severe or not that frequent.
One of the first things you should know about sickle cell disease: you can't catch it from anyone. It's what we call a hereditary disease, which means it's passed down through families, from parents to child, through their genes. Sickle cell generally affects a limited segment of the human population, most often those of African descent. But forms of the disease also occur in India, Saudi Arabia, even Greece. It's estimated that 8% of the African American population have what is called sickle cell trait, meaning they are a carrier of the disease. Some may never even know they have the sickle cell gene. They will probably never show any symptoms. That is why it's important to understand sickle cell disease and how it affects our bodies. The body is an amazing machine. For that machine to have energy, it needs oxygen from the air we breathe. That oxygen is picked up in the lungs and carried throughout the entire body by the blood flowing through our veins. Our blood is made up of millions of tiny red blood cells, and inside those cells is a protein called hemoglobin. This is what holds the oxygen. People with sickle cell disease have an abnormal hemoglobin called hemoglobin S, or sickle hemoglobin.
You can think of the red blood cell as being a balloon that's not quite filled up with air. When the hemoglobin S molecules lose their oxygen, the molecules start to stick together. They ultimately form long rods and distort the red blood cells.
These rigid rods actually change the shape of the blood cell. It begins to look like a sickle or possibly a holly leaf. These sickled cells become stiff instead of soft and squeezable like a normal blood cell, and they often can't squeeze through smaller blood vessels. When this happens, the blood flow is blocked so that the blood cells can't deliver their oxygen to that part of the body. The result is pain or even damage to the tissue of that area.
When the blood flow to any organ or tissue is interrupted, the body responds and notifies us of that by having pain, and that certainly is true for sickle cell disease. What probably is more important, though, is that when organs or tissues don't have blood supply and don't receive oxygen, they start to be damaged and ultimately to die. It's very important for parents to know the most that they can about sickle cell disease, so when problems are encountered, they can be identified early. That allows the parents to bring the children to see the doctor before the complications become too severe.
There are several different types of sickle cell disease. Sickle cell anemia is the most common and most severe. 70% of all cases are sickle cell anemia. The next most common is called hemoglobin SC disease, which accounts for about 30%. People with this problem usually have fewer or milder problems than those who have sickle cell anemia. When two people have a child, they are each contributing the genes that make up the child's DNA. The child ends up with a pair of each gene. If a parent is a carrier of the sickle cell gene, they are said to have sickle cell trait, meaning one of their two hemoglobin genes is sickle cell. Potentially, the parent could pass on the defective hemoglobin gene to their children.
People who have sickle trait have very few, if any, medical problems. Usually they aren't even aware that they carry the trait. However, people who have sickle trait can pass the ability to make sickle hemoglobin onto their children.
If both parents have the sickle cell trait, there are several possibilities with each pregnancy. The father could give the child the normal gene, and the mother could give the sickle gene. Their baby would have sickle cell trait. Or the father could give the sickle gene, and the mother could give the normal gene, and this baby would also have sickle trait. There's also a chance that both mother and father would pass on their normal gene. Then the baby would be absolutely normal. But if the mother and father pass on the sickle gene, the baby will have sickle cell disease in its most serious form, sickle cell anemia. Basically, this means that with each and every pregnancy of parents, both of whom have sickle cell trait, there will be a 1 in 4 chance that their baby will have sickle cell disease. A person with sickle cell anemia will pass the hemoglobin S gene to their children, so the child will minimally have sickle cell trait. The odds for the child to have sickle cell anemia increase dramatically if the second parent has sickle cell trait.
One of the first things that the parent of a new baby with sickle cell disease has to learn about is the pain. The pain occurs when blood supply is blocked or interrupted to a certain part of the body. In babies, the pain first seems to start in their hands and feet. The baby's hands or feet may be noticed to be swollen, or the mother might notice that when she brushes up against them or touches them, that the baby cries as if in pain. As the baby gets older, the pain seems to move more into the arms and legs. And when the child gets to be a teenager and an adult, the pain most likely occurs in the spine or in the backbone.
When a child is showing signs of pain, the parent should try to remain calm and sympathetic. There are a few things they can do to help. Apply a heating pad to the area, or giving a child a warm bath can sometimes help. If needed, the child should be given pain medication, like plain Tylenol. If that doesn't help, the next step is to give them Tylenol with codeine. Just make certain you're careful to give the correct doses at the correct times. If the pain still seems severe after about an hour, the child should be brought for medical attention because they'll need stronger medication.
Pain is a phenomenon that people with sickle cell will have to live with throughout their entire life. They have to learn how to tolerate a certain amount of pain. If they can't go to school or can't go to work, whenever they have a little twinge of pain, they're not going to have a normal life at all. On the other hand, we want to try to make their pain as bearable as possible. And so after allowing the child to understand that it's all right to have a little bit of pain, when the pain becomes severe, they ought to also feel confident that there is relief that can be provided for them.
The most serious problem for children is infection. Babies in particular have a very hard time fighting certain kinds of infections. This can be very serious.
Babies who have sickle cell anemia begin to damage and destroy their spleen within the first 4 to 6 months of life. The spleen is an organ that helps filter bacteria and germs from the bloodstream. It also helps the individual fight off certain kinds of infections. When the spleen isn't functioning properly and a child develops an infection with this certain type of bacteria, the infection can become very severe, can get completely out of control, and might even lead to death.
As a precaution, it is important for babies to be given penicillin. This common antibiotic helps to keep infections away. If a child is regularly taking the penicillin, they could still get an infection. The first sign may be a fever.
Even if a parent of a child with sickle cell anemia has seen that all of the doses of penicillin have been given, the parent must be very concerned about any fever that occurs. A child with sickle cell anemia who develops a fever must be approached as if the worst possible infection might have happened, because we can't be sure whether this is going to be a minor infection, just a cold, or whether it's something very serious when the child first develops fever.
Don't wait for the fever to get better or worse like you might do with a child that doesn't have sickle cell disease. Delay can be deadly.
The parents have to be very good observers, but in addition, they have to learn new ways of dealing with their children. As a matter of fact, this tendency towards having severe infection decreases as the child gets older. After the age of 5, the risks aren't nearly as high, but throughout their entire life, people who have sickle cell anemia will be at risk for having severe infections. And so that means that even an adult who has a fever should seek medical attention at once.
An illness that infects the lungs is serious for anyone. It's especially bad for someone who has sickle cell disease. The most common problem is pneumonia, an infection in the lungs. But people with sickle cell disease can have a variety of lung problems. If a child with sickle cell disease develops a cough or has problems breathing, he or she should be checked by a doctor immediately. All types of sickle cell disease cause anemia. Anemia means that blood counts, the amounts of blood cells in the body, are low. This happens because cells with sickled hemoglobin just don't last as long as normal cells. And although the body is constantly making new cells, sometimes it just can't make enough. The anemia seldom causes problems, but it can suddenly get worse. If you notice these symptoms, a pale coloring, weakness, or if the child is unusually quiet or tired, you should get medical attention as soon as possible. If the blood counts are dangerously low, treatment may require blood transfusion to restore the blood count. When the blood supply to parts of the brain is blocked, you can imagine that it can have serious effects, specifically a stroke. Usually strokes occur only in older persons, but children with sickle cell disease can also have a stroke. The resulting weakness and damage to the body can be very severe and even permanent. Fortunately, children often regain some or most of their strength. Signs of a stroke include weakness or clumsiness in the arms, difficulty walking, inability to speak clearly, unusual drooling, or difficulty swallowing.
If at any time a child with sickle cell develops weakness in the body, they should be brought to their doctor at once so that it can be discovered whether or not they've had a stroke.
Children with sickle cell disease are healthy most of the time. They should be given the opportunity to learn as much in school and to have as much fun as any other child.
But in the end, a child who has sickle cell disease is going to have problems. We can't change that. They have to be brought to the doctor much more often than what they would like to. They have to at times stay in the hospital. But in between those times, they should be encouraged to do as much as they can do and to do it as well as they are able to. They shouldn't be treated as if they are abnormal or unusual or unable to do certain things. They ought to be allowed to do as much as they possibly can.
As with any challenges in life, knowledge is power. The more you understand sickle cell disease, the better equipped you are to face up to any problems that it may bring to you and your family.
The parent who has a child who has sickle cell disease today can look forward to things being much better during their child's lifetime, and we can hope that the advances that have been made in the last 20 or 30 years will come even more rapidly in the next 20 or 30 years.